Hello, everyone. Welcome back to the Doodle Nurse. In today's content, we are going to talk about the Intellectual Developmental Disorder, or IDD. It was previously called as intellectual disability. This is one of the neurodevelopmental disorders, which is outlined in the DSM-5 TR and is an important topic for nursing students, PMHNP students like myself and other healthcare professionals. Just a quick disclaimer, this is for educational purposes only and shouldn't be used as a substitute for medical, psychiatric, or professional advice, diagnosis, or treatment. Please always consult a healthcare provider and follow your facility protocols. Now, let's begin with the DSM-5-DR diagnostic criteria. To diagnose IDD, three major criteria must be present. The first criterion is deficits in intellectual functioning. This includes the difficulties with reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and learning from experience. For example, a child may struggle to understand cause and effect relationships, solve age appropriate problems, learn new concepts at school, or apply learned knowledge to everyday situations. These deficits are typically confirmed through both clinical assessment and standardized intelligence testing. However, intellectual functioning alone is not enough to establish a diagnosis. The second criterion is deficits in adaptive functioning. Adaptive functioning refers to how effectively a person meets the developmental and sociocultural standards as expected for personal independence and social responsibility. The DSM-5-DR divides adaptive functioning into three domains, and the first is the conceptual domain. This includes the language skills, literacy, reading, writing, understanding money concepts, telling time, academic learning, and self-direction. For example, an individual may have difficulty managing finances, understanding schedules, following written instructions, or even learning academic material independently. Now, the second domain is the social functioning, and this includes the interpersonal communication, understanding social cues, recognizing emotions, maintaining relationships, social judgment, empathy, and awareness of social expectations. Individuals may struggle with making friends, understanding sarcasm, interpreting body language, or responding appropriately in social situations. Now, the third domain is the practical functioning, and this includes the activities of daily living, such as personal hygiene, dressing, meal preparation, medication management, transportation, occupational skills, and again, money management, recreation, and personal safety. Difficulties in this domain may require varying levels of support throughout life. Now, the third diagnostic criterion is the onset during the developmental period. Symptoms must begin during childhood or adolescence and cannot be explained by a condition that develops later in life. So, now let's talk about one of the most important concepts related to IDD, which the DSM 5 TR emphasizes that severity is determined by adaptive functioning and not the IQ alone. And severity levels include the mild, moderate, severe, and profound. Individuals with mild IDD often develop academic and social skills with support and may achieve a significant degree of independence as adults. They may need occasional assistance with complex life tasks such as financial planning or decision making. Individuals with moderate IDD generally require more support in daily activities, including the communication skills, and they may be present but often remain limited. Independent living is possible in some cases with ongoing supervision and structured support. Individuals with severe IDD, they typically have significant communication limitations and require assistance with most activities of daily living. They often need continuous support throughout life. Individuals with profound IDD have extensive impairments in communication, mobility, self care, and adaptive functioning. They require comprehensive and ongoing support in nearly all areas in life. As we move to the treatment and management section, it's important to understand that there is no cure for IDD. Instead, treatment focuses on maximizing independence, improving quality of life, and helping individuals reach their fullest potential. Early intervention is one of the most important treatment strategies, and research consistently shows that early developmental therapies improve long term outcomes. Speech and language therapy can improve communication skills and social interaction. Occupational therapy helps individuals develop daily living skills such as dressing, feeding, grooming, handwriting, and sensory integration. Physical therapy may be necessary for children with motor delays or mobility challenges. Educational support is very essential. Many children benefit from individualized education programs or IEPs, which provide specialized instruction and accommodations tailored to the student's needs. Educational interventions may focus on reading, mathematics, communication, social skills, and life skills training. Behavioral and psychological support may also be needed. Positive behavior interventions help reinforce adaptive behaviors while reducing problematic behaviors. Counseling can help address emotional challenges, anxiety, frustrations, and self esteem issues that may occur as individuals become aware of their difficulties. Family support is another critical component of treatment. Parents and caregivers often benefit from education, support groups, community resources, and respite care services. Because caregiving can be physically and emotionally demanding, supporting the family ultimately improves the outcomes for the patient. Medical management involves identifying and treating co-occurring conditions, and many individuals with IDD may also experience additional challenges such as autism spectrum disorder, ADHD, seizure disorders, genetic syndromes, anxiety disorders, or mood disorders. Regular medical monitoring helps ensure these conditions are identified and treated appropriately. Now, let's also discuss some associated features common seen in IDD, and language delays are common. The motor skill delay may affect walking, coordination, and fine motor tasks. Learning difficulties often persist throughout life. Social understanding challenges may affect peer relationships and communication. Some individuals may have associated genetic or medical conditions such as Down syndrome, Fragile X syndrome, cerebral palsy, or seizure disorders. As nurses and future PMHNPs, our role extends beyond diagnosis. We also have to use clear, simple communication and provide instruction in a way that matches the patient's developmental level. Assessment should focus on adaptive functioning across all three domains rather than relying solely on IQ scores. Family and caregivers should be actively involved in care planning because they often provide valuable insight into the patient's daily functioning and support needs. We should also always promote dignity and autonomy and person centered care, advocating for educational services, community resources, safety planning, and access to healthcare is a vital part of nursing practice. The ultimate goal of care is not simply symptom management, but the goal is to maximize independence, improve quality of life, encourage community participation, and help individuals achieve their highest level of functioning. Now we have to remember this rule. For IDD, diagnosis requires deficits in both intellectual functioning and adaptive functioning, and severity is determined by adaptive functioning rather than IQ scores alone. Thank you for watching the Doodle Nurse and see you next time.